Welcome, everybody, and thank you so much for joining us this evening. I'm Dr. Mira Koro, and I'm a clinical pharmacist working in a hospital in Vancouver. I've been with the Meditation Center here in Vancouver since 2008, and it's been a very rewarding and life-changing experience. So I invite you all to join us. And today's topic will be about high blood pressure, and we'll be covering meditation and medications for high blood pressure. Since this presentation is being recorded, please reserve your questions till after the lecture. And let's begin. So the objectives for today's workshop is to understand what high blood pressure is as a medical condition. So we'll be going over how to measure your blood pressure, how it is diagnosed, what the normal values are, a better understanding of high blood pressure. And secondly, to review medications that control high blood pressure, the different pharmacological groups that are being used, and what are the advantages and disadvantages of each medication. And then to discuss how changes in lifestyle and practicing meditation can positively influence high blood pressure, meaning decrease your high blood pressure. Points to think about. If we look at factors contributing to high blood pressure, we notice that some factors are related to the body and some are related to the mind. Only 2 factors are related to the body, and the majority of the causes or contributing factors to high blood pressure are related to the mind. So you see, our poor habits that increase our blood pressure are smoking, alcohol, an unbalanced diet, a lack of exercise, and all the stressors and worries of life. All these originate at the mind level, while factors that are related to our body, which are not within our control, what are also called non-modifiable risk factors, are our genetics or our family history, and also the fact that our bodies age. Let's take a look at some statistics locally here in Canada. 44% of people do not know what normal blood pressure values are. 80% of people are unaware that there's a connection between high blood pressure and heart disease. And 63% of people believe that high blood pressure is not a serious condition. The bloodstream, or what is called cardiovascular system, as you see in the picture, consists of the heart and the blood vessels. The heart acts as a pump, pumping out the blood to different parts of the body. And the blood vessels are like pipes where the blood passes through. And the blood is important to give nutrition and oxygen to different cells of the body. If you see in this picture, there are the red blood vessels, which are the arteries that carry all the oxygen to the cells of the body. And the blue are the veins that bring the blood back, which needs oxygenation, back to the heart and the lungs. So what is meant by blood pressure? It's the amount of force that the blood exerts on the inner walls of the arteries or the veins as the blood circulates around the body. The heart, as we mentioned, is a pump. Here in the picture, you see the heart is expanding or contracting. So during diastole, the heart relaxes and stretches out. So this is diastole, when the heart is relaxing. And during systole, the heart contracts and forces the blood out of the major arteries. This is systole. The heart is contracting and pumping out the blood. So what do the numbers mean when we measure our blood pressure? The upper numbers represent the pressure when the heart is contracting. So when the heart is forcefully contracting, this is called systolic blood pressure. And when the heart is relaxing, this is called diastolic blood pressure. So as you see, we have two values for blood pressure, an upper one, which is when the heart contracts, and the lower one when the heart is relaxing. And here we're measuring the pressure of the blood in the arteries. This is a test question. If you would like to unmute your microphones, you can participate. And these are different measurement devices. On your left-hand side, you see a device that is applied to the upper arm, and it measures blood pressure. And on your right-hand side, you see a device that's applied to the wrist and measures blood pressure. So the question here is, which device is more accurate for measuring blood pressure? Which device should people buy? Would anybody like to answer that question? Please unmute.
The left?
Yes, that's correct. The left one. The one that's attached to the upper arm is much more accurate than the one on the wrist. So the one on the wrist is so inaccurate that it can change your systolic blood pressure or the higher value by 20, which is very, very significant. So people might not have high blood pressure, but it can give you a falsely high result. And that's why it's not really recommended. How to measure your blood pressure? The proper way is to sit on a chair in the sitting position. So don't measure it while you're lying down or while you're standing. In the sitting position is best. So rest for at least 5 minutes before the reading. So when you are sitting for 5 minutes, do not exercise directly before that. And also refrain from talking, because talking can give falsely high results. And when you apply that cuff to your upper arm, remove the layers of extra clothing, because these might give a false reading if it's unable to properly reach the blood vessels. And then you see that the arm is rested in this picture in a 90-degree angle. And this at least ensures that the cuff that's placed on the arm is at heart level to get the most accurate reading. Signs and symptoms of high blood pressure. You often hear that blood pressure is silent killer. And the reason they call it that is that it does not usually show any signs or symptoms. So most people go undiagnosed. And some people do have rare symptoms, such as headaches, and they don't know what is causing their headaches, or they might feel dizzy, or have nosebleeds. That is if they do have symptoms at all. And that's why the only way to know is to have your blood pressure checked. So you can either go to your family physician or even go to your community pharmacy, and some pharmacies do have blood pressure measurement devices that you can use. If blood pressure or high blood pressure is not detected on time and treated, it can have complications. So as you see, there might be complications on different organs of the body, but usually the short-term complications are at the level of the retina or the screen of the eye and at the kidney level. So those are the smallest blood vessels in the body, the eye blood vessels, and the small blood vessels in the kidney. Those are the ones that are destroyed first when the blood pressure becomes high and it's uncontrolled or untreated. And then if it remains untreated for some time, then other organs can be affected. The heart can lead to heart attacks or heart failure, can lead to a stroke, which is a blockage in the blood vessels of the brain. And it can lead to arteriosclerosis, which is narrowing of the blood vessels. So in order to avoid all those complications, it's best to detect the high blood pressure early and treat it early and remain on treatment. From a diagnostic perspective, all adults should have their blood pressure checked regularly. Some people think, oh, I'm too young, I might not have blood pressure, I don't need to check it. But high blood pressure can start early, so all adults are advised to check their blood pressure. So in order to diagnose blood pressure, in addition to all the previous factors that we mentioned, it's important not to measure it if you're anxious or stressed, because that gives a false reading. The heart is beating faster when one is stressed. So in a relaxed state, and at least three readings are needed at different times and on different days. So if you find one elevated reading, this does not mean that you have high blood pressure. You need to check your blood pressure at least 3 times on 3 different days. And if it's elevated, then that is how it's diagnosed. As we mentioned before, systolic blood pressure is when the heart is contracting. And diastolic is the pressure in the blood vessels when the heart is relaxed. The blood pressure is measured in millimeters mercury. That's the unit that's used. For example, you see this reading of 120/80 millimeters mercury. The higher number is the systolic blood pressure, and the lower number is the diastolic blood pressure. So what are the normal values? For adults and for seniors alike, the normal blood pressure should be less than 140/90 if one does not have diabetes. So less than 140/90. If it's over that, then it's high blood pressure. And remember, we need 3 readings, 3 high readings. Now, for people with diabetes, blood pressure needs to be more tightly controlled and should be less than 130/80. So let's keep the 140/90 in mind now for adults and assess as we go. This is a test question. Which of the following blood pressure values are normal? Let's start with A. Who thinks A is a normal blood pressure? Please unmute your mics and share.
No.
Okay, it's abnormal. Why?
162 is a high.
Yes, the systolic blood pressure or the higher value is high. That's perfectly right. B, is 128/96 a normal blood pressure?
Yes.
Okay, think again. 128?
No. No, the 96 one is high.
96 is a little higher, but it's very close to lost now.
Very close to 90. Yes, perfect. Good job. Yes. So it's above 90. So if we have 3 readings where the diastolic blood pressure is above 90, then this is diagnosed as blood pressure. Although now the new direction in medicine is to focus on the higher value, which is the systolic blood pressure. There's not much focus on the diastolic blood pressure. How about C? Blood pressure of 116/70. Is that normal or abnormal?
That's okay for diabetic people.
Excellent. Yes. Okay for diabetics and okay for adults as well, and seniors. It's
That's
all
low.
good. C. What about D? A
D
blood
is on the
pressure.
low side.
Sorry, say that again, please.
Sorry, it's a low blood pressure.
It's a low blood pressure, yes. And that might contribute to dizziness or falls, and we'll talk about that later as well. So now we have a good idea how to assess our blood pressure. Often when you look at blood pressure measurement devices, you see that there's a heart rate or pulse that's also reported on the device. Sometimes it has the shape of a heart there. So it tells you how many times per minute your heart beats. And the normal range for heart rate is usually 60 to 80 beats per minute. Sometimes if it goes up to 90 in the elderly, that's okay. But if it's above 100, then we're thinking, oh, this heart rate is really high. So when we study blood pressure, we also look at the heart rate or the pulse to be able to make the best decisions for what medications to use. So please keep that in mind. And sometimes when one is stressed, you might see that blood pressure is a little bit elevated, but the pulse is much higher. Low blood pressure. So it might cause dizziness or falls in some people, especially when they change position. So for people who have high blood pressure, who are on medications, the recommendation is change positions very slowly because your blood pressure might drop suddenly and you might feel dizzy and fall. So when you're in a sleeping position or lying down position, change very slowly to a sitting position. So over like half a minute, change from sleeping to sitting and sit on the side of your bed for a minute for your blood pressure to normalize so that you don't feel dizzy. And also when you want to change from sitting to standing, take that very slowly so that your blood pressure doesn't drop. So from that, we understand that the blood pressure is highest when we're lying down, lower when we're sitting, and the lowest when we're standing. And that drop in the blood pressure upon changing position is termed orthostatic hypotension. So please remember, if you're on blood pressure medications, change positions slowly, stand up slowly. And this is just showing how blood pressure fluctuates during the day. So the value does not remain the same all the time. And that's why you don't need to measure your blood pressure every 10 minutes or every half an hour because it keeps changing. And sometimes they say blood pressure is like waves. It keeps fluctuating up and down. So here you see when we're sleeping, blood pressure should drop to the lowest. And then when we rise up in the morning, it increases. And then when we're doing our daily duties, it can increase even further. So it's not concerning. That is the normal rhythm of blood pressure. It keeps fluctuating during different times of the day. Some people, for example, when they go to the doctor and measure their blood pressure, they discover it's abnormally high, and that's because they're stressed from going to the doctor's office. That is termed white coat syndrome. So if you're one of those people who's stressed when you go to the doctor's office and your blood pressure reading at the doctor's office might not be that accurate, please measure it at home, because you can be falsely diagnosed as having high blood pressure at the doctor's office. So blood pressure usually changes, as we saw, according to night and day, or according to the types of activities that we're doing. Also when we're exercising. So never measure your blood pressure when you're exercising, because it will normally be elevated. And also when we age, the blood pressure is higher. And we talked about different blood pressures in different positions, such as lying down, sitting, or standing. Sometimes there is a lot of research actually that shows for some people their blood pressure increases seasonally. So when it's winter time, the blood vessels might shrink a little bit more, and the pressure of the blood in those blood vessels might increase. So seasonal high blood pressure is a reality. When we're too emotional, or we're too stressed, or depending on the method of our breathing, the blood pressure fluctuates accordingly as well. And that's why it is of utmost importance to keep our emotions and mental status under control and ensure enough oxygenation is reaching our different organs of the body and reaching our brain. We also discussed white coat syndrome. When we go to the doctor's office, some people tend to be more stressed and can give a false blood pressure reading. Also, consuming caffeine on a daily basis increases your blood pressure. So for example, a cup of coffee a day contains about 90 milligrams of caffeine. And that alone is sufficient to increase your blood pressure significantly. So if you have high blood pressure, skip that coffee a day, and it might help decrease your blood pressure further. Additionally, a cup of tea, which is containing caffeine, contains about 30 milligrams of caffeine. So that can be tolerated because it's not really a big amount of caffeine, but not to exceed a cup a day. And salt, we'll focus on that later. Alcohol intake also should be limited or restricted, as it tends to have an influence, a bad influence on blood pressure. Also, medication compliance, or adhering to your daily dose of blood pressure medication, helps to keep the blood pressure under control, because the effect of the medication is a cumulative effect, and so blood pressure medications should be taken regularly every single day. When to seek medical attention. Many people ask, when should I go to my doctor, or when should I go to the emergency department? How to assess that? So go to the emergency department if your blood pressure is very high, and we'll be looking mostly at systolic blood pressure, which is the higher value of the blood pressure. If it's exceeding 180, then your blood pressure is really high, and it's recommended to go to the emergency department. So above 180, it's in medical terms, it's called a hypertensive urgency, means it's urgent to deal with it. And if the systolic is above 200, they call it a hypertensive emergency. So it must surely be urgently controlled. And then if somebody has high blood pressure, regardless of the value, but is experiencing signs and symptoms of stroke, such as slurred speech, numbness, weakness in one side of the body, then that needs emergency medical attention. Or if someone is having signs or symptoms of heart attack, so if they're complaining of chest pain, all chest pain should be directed to the emergency department, regardless how high or low your blood pressure is. So if anybody experiences chest pain, it could be a serious sign of a heart attack, and it must be investigated in the emergency department. So go to your doctor's office if your blood pressure is not under control, meaning if you see your systolic blood pressure is at 150 or 160, more than 3 times you measured it, so okay, that needs to be dealt with, and go to your physician. Or if your blood pressure is very low to an extent that it's causing symptoms for you. So if it's causing dizziness or falls, then that warrants a visit to the doctor's office to adjust the blood pressure medication accordingly. And also, please see your doctor if you are not tolerating your medications, if you're having serious side effects that are prohibiting you from using your medication that was prescribed for you. So there's a very interesting tool that assesses the risk of developing heart attacks and strokes in the next 10 years. So now we know that one of the risk factors for developing a heart attack or stroke is having high blood pressure. So there is a very strong correlation between high blood pressure and having heart attacks and strokes. And that's one of the main reasons that we would want to control our blood pressure. So leaving blood pressure aside now, we can assess our risk of developing a heart attack or a stroke in the next 10 years. And that's called Framingham risk score. This is a very nice tool. You can just Google Framingham risk score, and it gives you that nice calculator. You enter your information in there, and it calculates the score for you. So basically, if one has a score of 15%, it says that in the next 10 years, 15% of people with similar risk factors will develop a heart attack or stroke. And also on Google, it can explain to you the normal ranges, but if the score is less than 10, then you're at low risk of less than 10%. You're at low risk of heart attacks and strokes. If it's between 10 to 20, it's intermediate risk. And if it's above 20, then it's high risk. And this tool is only useful for people who have never had heart attacks or strokes before. So it's a very entertaining tool, and it's recommended by the Canadian Cardiovascular Society, and we do that risk calculation in hospital to determine how tightly we need to control all the risk factors for each patient. So as you see, the factors that they consider are age, gender, because males are at higher risk of heart attacks and strokes than females. High cholesterol is also increasing the risk. Being a smoker or a diabetic or having a high blood pressure that's uncontrolled by medication is also a risk factor. So how do we decrease our risk factors? Mainly now going back to high blood pressure. How do we decrease our high blood pressure? And these interventions are, as you see, recommended by Hypertension Canada guidelines. So those guidelines are the main guidelines that medical practitioners follow in Canada. And these are the guidelines specific for blood pressure. There's a section in those guidelines for medical practitioners, and there's another section for patients. So if you want to know more about your blood pressure in simplified language, please go to Hypertension Canada, Google Hypertension Canada, and look for information for patients. So those guidelines were taken from there. They recommend to exercise at least 30 to 60 minutes most days of the week. So try to exercise daily. And the type of exercise recommended here to significantly decrease the the risk of high blood pressure is aerobic exercise, which means to an extent that let's say you're running on a treadmill and you're breathing faster to an extent where you can barely talk and you cannot sing. So that aerobic exercise that increases your heart rate is the one that benefits most in high blood pressure. However, if for any medical reason you are unable to do that, even walking 30 minutes a day, slow-paced walking makes a big difference. The importance of a balanced diet is also explained in these guidelines. So staying away from high-fat foods. And high-fat is usually in meat and chicken, red meat and chicken, and that's why a vegetarian diet is highly recommended. And a vegetarian diet can be complete, as you see in this picture. It contains all the elements, all the food items that you need for daily living. So some people argue that, oh, we need meat to get our essential amino acids or our essential proteins. That is incorrect, because if you have a complete vegetarian diet, you can have all the proteins you need through beans and lentils, for example, and you need about 3 servings a day of those. And you can get your carbohydrates through grains and starchy vegetables. And of course, fruits and seeds and nuts. Nuts have all the fatty acids that one needs. And the vegetables mainly have all the minerals and vitamins that one needs. And that's why we advocate for a vegetarian diet. And there's also focus on getting at least 5 servings of fruits per day and veggies. Another intervention to control your blood pressure is to restrict the salt intake. So the guidelines say consume less than 5 grams of salt per day. And that's sodium chloride or the regular salt that we use every day. Do not exceed a teaspoon, and that's not a full teaspoon, but that's a kind of a partial teaspoon. And the way to do that is try to establish a habit not to sprinkle salt on your food when you eat it, and add minimal amounts of salt to your food when you're cooking it. And of course, avoid processed foods. So if you buy processed foods, then they can contain a really high percentage. If you buy a pizza, for example, it has a very high percentage of salt. So stay away from processed foods. Another way to keep the blood pressure down is to stop smoking. And they discovered that one who stops smoking cuts down the risk of heart attacks by 30%. So the biggest intervention to cut down the risk of heart attacks is to stop smoking. And the reason is that nicotine increases the blood pressure, and all the toxic substances from smoking are deposited inside the blood vessels, making them narrower and smaller and causing more blockages and putting oneself at risk of heart attacks and strokes. So help is available, and there is a program through the Canadian government called Quit Now. It's a fully free program. All you have to do is call the nursing line at 811 and say, I want to subscribe to Quit Now program, and they provide everything for you. The nicotine replacement patches, the nicotine gum, other medications that might help decrease cravings to cigarettes. So everything is included in that program. And another factor, which is very, very important nowadays, especially in this pandemic situation that we're facing, and Many people are stressed. It's of utmost importance to reduce stress, especially mental and emotional stress. And learning meditation is one very important tool to reduce the stress, learning to control the mind, and even learning to manage one's own thoughts. So meditation classes are offered at the Brahma Kumari's Meditation Center in Vancouver and in other cities. This is the website. If you would like to subscribe to those courses, they're all offered free of charge as a community service. The website might not be very clear on the screen. It's vancouver.brahmakumaris.ca. So very deep meditators that reach a high stage of enlightenment can even use their minds to bless the food that they eat, to purify the food and the water. And this powerful energy or vibrations that are sent to the food is called drishti. So you see to what stage one can reach in controlling one's risk factors for heart attacks and strokes through meditation. Now, the next objective is to cover blood pressure medications. So one person may need more than one blood pressure medication to control their blood pressure. Some people need up to 4 or 5 blood pressure medications to control the blood pressure, because with time and aging, it might become higher and we need to combine medications. It's important to take your medications regularly, every single day, not to miss any doses, because we want to make sure that this blood pressure is under control and we're not getting any complications. And inform your pharmacist if your doctor has added a new medication for you, or if you're taking other over-the-counter medications or any herbal products, because your pharmacist will be able to tell you if any of these interact with your medications. For example, taking Advil, which is over-the-counter, on a regular daily basis can contribute to increasing your blood pressure. So please be aware of this. It does not mean that you should avoid Advil, but in general, taking some medications for the long term can contribute to high blood pressure. So medications need to work hand in hand with lifestyle modification. So we talked about all the lifestyle modifications as above. And when one usually starts with blood pressure medications, they are lifelong. And high blood pressure, once diagnosed, does not usually go away. It continues lifelong. The first group of medications is called thiazide diuretics, or water pills. So this is the Zide family. As you see, the word here ends with Zide. I've used generic names or chemical names of medications so people don't get confused. So this is the generic name of your medication. So under this diuretic family, there is the member hydrochlorothiazide. Another medication is chlorthalidone and indapamide. So these water pills, because they make you pee more often, they say take them in the morning or at noon, because if you take them in the afternoon, you might not be able to sleep at night because you have to wake up and pee. Side effects of these water pills is that they not only get rid of water in your body, decreasing your blood pressure, but they can also get rid of essential salts, such as potassium, sodium, and magnesium. So when you see your doctor, make sure that you check your salts on a regular basis. You do a lab test called electrolytes, check your electrolytes, and make sure that they are not low. Because so many people can, especially the elderly, can get confused because their sodium is low and they don't know why, but they are on a diuretic. Also, this group of water pills can increase your uric acid in your blood, causing what's called gout. Or they can increase your cholesterol levels or your sugar levels. So make sure you also ask your doctor to check those if you are on a water pill. So as you see, those water pills work mainly on the kidney and makes people urinate the water and the salts out, decreasing the blood pressure. The second group of or family of medications that's used to control blood pressure is called Angiotensin Converting Enzyme inhibitors. It's a complicated name. Just try to focus on the Pril family. This is called the Pril family. So you see that all the names of the medications end with the word Pril: Ramipril, Perindopril, Captopril. So this is the Pril family. This family has the best evidence in research showing that it prevents morbidity and mortality. Morbidity means diseases that affect our quality of life. So they tend to decrease diseases in general and tend to decrease the rate of early death. So this family, the Pril family, has the best evidence. And when one is newly diagnosed with high blood pressure, we suggest to physicians that they start medications with the Pril family because it's the safest and has the best evidence. So this family can be used to decrease your blood pressure. It's the first line. It can also be used for heart conditions, and it has a protective effect on the heart. So if years and years of blood pressure, the heart is exposed to high blood pressure, then the blood vessels of the heart or the muscle of the heart starts changing, and that's called remodeling. So the heart is usually a very strong pump. And with time, if blood pressure is not well controlled, it can start failing and can become saggy and baggy and unable to pump well. So in order to prevent that from happening, this group of medication has a protective effect on the heart. It prevents remodeling, which means it prevents the heart from becoming saggy and baggy or fibrous, and it maintains it as a strong muscle. And thirdly, this group of medications is used to prevent kidney disease. So for people who have diabetes, it can protect them from developing kidney disease early. So it postpones kidney disease from happening. But the problem with that group of medication is that 15% of people, which is like 1 in 8, develop a dry cough. And you might notice many people who don't have allergies or anything, they might have just a dry cough and they sound like they're clearing their throat, like and that type of cough is a side effect of this medication. So if that happens and 1 in 8 people is a high percentage, then we switch them to another group of medication. Angiotensin receptor blockers, it's called. So this is the Sartan family. The Sartan family is really the best medication you can have to control your blood pressure. And as you see, all those medication names end with sartan. Candy sartan, low sartan, val sartan. And they are very, very similar in their action to the Pril family, but are much more selective on the receptors, and that's why they don't cause a dry cough. So for patients who are not tolerating the Pril family, we switch them to the Sartan family, and that prevents the dry cough. The fourth group of medications is called calcium channel blockers. And this is the Dpine family. And the family members are nifedipine, amlodipine, and felodipine. How they work is they affect the calcium movement in the heart and blood vessels, and that relaxes the blood vessels, and so the blood pressure drops. And they can be used not only for blood pressure, but can be used for angina or chest pain or abnormal heart conduction, and they are preferred in stroke. Best medications for people who have already had a stroke. There are three main side effects for the Dpine family. So if somebody is on amlodipine, let's say, it's very common to see ankle swelling. So you look at the foot and you look here in this area at the ankle, and you see a certain degree of swelling. If it's mild, we tend to ignore it. But if it becomes significant, then the medication should be changed, and please bring that to the attention of your physician. Other side effects are also headache and flushing. Flushing, you notice it on the cheeks, redness on the cheeks. These are not the best group of medications to start with for blood pressure, but they are the first choice for people who have had a heart attack, a stroke, sorry. The last medication group is called beta blockers. This is the LOL family. The LOL. And you know why they laugh out loud? Because they are the strongest and most powerful blood pressure medications you can ever use. So they keep laughing. They end with LOL, metoprolol, atenolol, bisoprolol. Those are the ones that work specifically on the heart. And then there are ones that work specifically on the extremities that are propranolol, carvedilol, and labetalol. These medications slow down the heart rate. So these don't work mainly on the blood pressure. They work on slowing down the pulse or the heart rate. So for people who have a slightly elevated blood pressure or heart disease, and their heart rate is very high, this is the choice for them because it controls the heart rate or the pulse. And it can be used in other heart conditions, such as angina or abnormal rhythms. They are classified as a last resort for high blood pressure. So we never start with this group of medication to control blood pressure alone. And all these treatments that we're discussing are mainly for blood pressure. Heart medications can be slightly different. What's very important about beta blockers or the LOL family is not to stop taking them abruptly. Don't stop them suddenly because the body is dependent on them. And if you remove them suddenly, then the adrenaline might bind to the receptors and one might get a heart attack or a stroke as a result of that. So always take your medications daily, and if you need a dose reduction, it should be a gradual dose reduction and under medical supervision. Some of the adverse effects are fatigue. So one might feel very tired or depressed because they're very potent, very strong blood pressure medications and might cause some fatigue. And for people who are asthmatic, it might worsen asthma. And for people who have high blood sugars, it might mask the symptoms. So when one sometimes becomes shaky, they feel that the blood sugar is low, those symptoms are masked or covered up by this group of medication. So it might not be the best choice for asthmatics or diabetics. They can cause some cold hands and feet or decreased ability to exercise. So tips to help you take your medications regularly. If you're a person who's not very adherent to taking medications, you could use the weekly pill organizer and put your medications in that organizer. Or if you have more than 6 regularly scheduled medications, then your local community pharmacy can blister pack your medications for free. This is called a blister pack or a bubble pack. And if you have more than 6 regularly scheduled medications, then your pharmacy will not charge you for this blister pack. You can, as you see, they can prepare a weekly blister pack for you. This is like your morning medications, your noon, your evening, your bedtime medications. They're arranged so nicely so you don't have to arrange them in a weekly organizer. And most importantly is keep an up-to-date medication record in your wallet. So you can keep a list of all your current medications. So if something happens on an emergency basis, they can know in the emergency department what medications you're on. And now paramedics have shared with me as well that you can enter all your medications on your smartphone. There's a way to do that apparently in the settings. And when you enter your emergency contact person, you can also enter a list of your medications. And paramedics, if you're living alone, know how to access your phone. They don't need a password, and look up all your medications and even your medical conditions. You can add them there. And bring those records to your doctor at each visit. One of the most common medication errors that happen is that when during a doctor's visit, sometimes the physician is in a hurry, doesn't have much time, so does not check the list of medications. So there might be duplications of treatment. There might be medication errors. So make sure you show your doctor the list of your medications at every visit. How the body controls blood pressure. Firstly, blood pressure is controlled through our central nervous system. The central nervous system is the brain, the spinal cord, and all the peripheral nerves that go to the peripheries. And the nervous system is made of a sympathetic nervous system or parasympathetic nervous system. These are very complex words, but basically there are 2 components of the nervous system. One component that's activated when we are in a fight or flight response. So if you're being chased by a dog who wants to bite you, then your nervous system, your sympathetic nervous system activates, fight and flight response is activated, and you start running, you start breathing very fast, your muscles are activated. So that's the fight and flight response, and that one increases the blood pressure significantly. So in our daily life, if we're constantly on the run or we have burnout syndrome, then we keep activating our nervous system, our sympathetic nervous system. We go into fight and flight, we keep our blood pressure high. And on the other hand, the other component of the nervous system is the parasympathetic. This is the one that keeps us at rest and helps us digest our food, and it promotes healing. So we would want to remain in that zone. And that zone, the parasympathetic nervous system that keeps us in the healing mode, in the restful mode, is where meditation exactly works. And there you see the importance of meditation in controlling our central nervous system, our peripheral nervous system, and our blood pressure. The kidney also plays a role in controlling blood pressure. It produces stress hormones, and it keeps our blood pressure on the higher side that way. And then if we learn to control our stress, hopefully through meditation, then all those effects on the kidney are stopped, and we can control our blood pressure better. So I searched the literature or all the research that's out there to see how many studies describe the effect of meditation on blood pressure. So there are hundreds of studies that describe how meditation can help control our body in general, and there are specific studies about blood pressure. So what does meditation do for us? And this again is based on research. on strong research. So it shifts our brain waves, shifts the brain waves to the relaxed waves. Last lecture, we talked about brain waves. I don't want to touch on that again, but basically, when we're in the relaxed mode, the body systems are relaxed as well and function better. We can control our nervous system. And there's an increased secretion of happy hormones when we are in that relaxed state of mind. And happy hormones are like serotonin and dopamine, and that improves our mood significantly. And then when we're operating at that higher level of consciousness, our body produces more painkillers, keeping our pain under control. It also decreases stress hormones, and it helps the body oxygenate much better. So the conclusion is the best cure for the body is a quiet mind. Let's very fast look at the mind and how we create our thoughts. This is like a cycle where the mind starts creating thoughts. So the mind is the faculty that's responsible for thought generation. So whether it's positive thoughts or negative thoughts, thoughts are generated and they move to the intellect. The intellect is the judge that decides, shall I allow those thoughts to go through or not? So the intellect, a powerful intellect can make a big difference. So a powerful intellect can allow positive thoughts to go through and control the negative thoughts. So let's take an example. Smoking, for example, is one of the factors that we need to control in our lifestyle in order to decrease blood pressure. The mind generates a thought, oh, let me try to smoke, or let me smoke a cigarette, and that goes to the intellect. If the intellect is powerful enough, then it would stop that thought and say, no, smoking is bad for you, and that's where it stops. If the intellect is not strong enough, then those negative thoughts go through, one starts smoking, and that affects the impressions. That becomes a habit. Impressions are basically habits, and those habits are stored in us. And each time the mind thinks bad thoughts, and if there's a weak intellect that allows it, this is what happens. So you see that all these habits of smoking, alcohol, bad diet, not exercising, and stress, these are all becoming habits because we have a weak intellect that's not in charge. So basically, Raja Yoga meditation teaches us how to think, how to manage our thoughts, how to manage our minds, and how to be in control in our lives. This is another look about on the thought process. So you see how the mind generates the thoughts, and it also generates our experiences. The intellect is the willpower. It evaluates, reasons, decides, understands, and then whatever thoughts go through the intellect, they come into action. So come into action through words, through our daily routines. So these become our habits, and our habits again dictate what our mind thinks. So you see how they're all interconnected. But the most powerful of all is the intellect, and this is where we work on through meditation. If we have a powerful intellect, then we can control the mind, control the habits, and transform our lives. So some of you might be familiar with Albert Einstein, and this was his conclusion in life. No problem can be solved from the same level of consciousness that created it. So what he's basically saying is, raise your consciousness to a higher consciousness. This is achieved through empowering the intellect. So empower the intellect, operate at a much higher level, And that empowerment is done through meditation, so that everything else is clear for you. Thank you very much for listening to this workshop. And now we'll allow questions, and please stop the recording here so people can feel free to ask their